Zachary back with you here at Practically Social. This week on episode 8, we're covering cognitive behavioral therapy basics. By the end of the video, you should have a good grasp on what CBT is and what it can do for you when used either on your own or with your preferred therapist. There's tons of good resources out there such as workbooks, manuals, and theory which can also inform you. Before we get started, remember that when you hit subscribe, an angel gets its wings. Just kidding. However, when you do hit subscribe, you increase the chances that someone who really needs help might see this video. When the channel grows, others grow too. Leave a comment for what you'd like to see covered in upcoming episodes there in the comments section. Okay, let's talk about cognitive behavioral therapy. Cognitive behavioral therapy isn't new. It's been around since the 1960s and is a combination of ongoing developments in psychology throughout the 20th century, going all the way back to Pavlov and his dogs. The American Psychological Association defines cognitive behavioral therapy, CBT, as a form of psychological treatment that has been demonstrated to be effective for a range of problems, including depression, anxiety disorders, alcohol and drug use, marital problems, eating disorders, and severe mental illness. Numerous research studies suggest that CBT leads to significant improvement in functioning and quality of life. In many studies, CBT has been demonstrated to be as effective as, or more effective than, other forms of psychological therapy or psychiatric medications. CBT can produce change. How, you might ask? CBT places an emphasis on helping individuals learn to be their own therapists. This doesn't mean in 2 sessions as your therapist that I'm going to say, okay, there you go. You learned it all. Now you can be your own therapist. Trust me when I say that I'm here to listen, understand, and help you learn how you can be a therapist to yourself, though that might take some time. Once you've made some progress and you're feeling more effective, even if you feel good enough to stop going to therapy, you can always return later and brush up on those skills you learned. To put it another way, the goal of CBT, according to the National Institute for Health, is to reveal and change false and distressing beliefs. Because it is often not only things and situations that cause problems, but the importance that we attach to them too. We'll be revisiting that here in a few minutes, so stick it back there and hang on to it, okay? CBT is my preferred theory base to work from in individual, group, and couples counseling. I've personally seen it help hundreds of clients better understand where much of their thoughts, feelings, and habits come from. I've developed my own approach to CBT and will be sharing some tools I like to use in future videos. Remember also that CBT was the foundation used to create dialectical behavior therapy, or DBT, as well as being an influence in the creation of acceptance and commitment therapy, or ACT. These approaches also appear time-tested and useful for many clients. Today, we're going to cover some of the fundamental concepts of CBT in order for you to learn, discuss, and share. It's my hope that if you're new to therapy, or even if you've been going for a while and your therapist has mentioned CBT, that this material will help guide you to some real solutions. Perhaps the most important thing I have to say about beginning with CBT is that the purpose is right there in its definition. We'll discuss cognition, or how we think about things, and how we began thinking about things, as well as how our thoughts eventually lead to feelings and our behaviors. I'm also going to stress that CBT is one way of approaching therapy. It isn't the only way, and if for some reason you don't find it to be useful, you aren't obligated to continue pursuing it. Discuss this with your therapist if you're struggling, and ask as many questions as you'd like. The way I approach CBT is by first starting with comprehensive bio-psycho-social spiritual assessment if possible. For most people entering therapy, this happens in the beginning, usually in the form of a long interview with a therapist. They'll go over your past and ask several questions about how you developed mental health concerns. This is useful for a starting point. I usually review this before someone's first session if I have time, or I might review it with them in their first session as a way of getting to know them more and exploring what issues they'd like to address by setting a goal. Once we've accomplished that, we can get into the time machine and start the story about where they grew up, who they grew up with, and what their childhood was like. We cover things like parenting style, significant events, as well as dysfunction or trauma, if that occurred. Talking about the past brings us to our first CBT foundational idea, beliefs. Since family is our first cultural experience, we pick up much of what we know about life or believe about the world and ourselves at a young age. We recognize that we learn by observation. This is a key step. Don't be fooled into thinking that CBT is only about staying in the present. The past is very important to how I approach CBT with my clients. Next, we'll discuss how our earliest experiences and beliefs set our second foundational idea, thinking, or what we refer to in CBT as self-talk. This doesn't mean you're literally talking to yourself, more that it's the repeated thoughts that seem to have a voice and influence our feelings and decision making. These two items are next in our model. Number 3, emotions or feelings, good, bad, or otherwise, and number 4, behaviors or actions, which others can observe us doing or not doing. I put an asterisk next to behaviors and actions there. We also may define action as inaction. Avoidance is an action we often see in depression. Even though that might not make much sense, I will return to discuss it in later examples. So there we have 4 basic foundational ideas of how I describe CBT theory and models to my clients. At the beginning of our lives, our experiences and observations lead us to certain beliefs through learning. This process is usually automatic and, in my opinion, unquestioned, because our brains at a young age haven't developed complex critical thinking. So beliefs remain there for quite some time and may or may not be changed later. We do have the capacity as adults, however, to change those beliefs. Arising from our beliefs comes thought, and thought is the internal dialogue or self-talk first discussed when CBT emerged back in the 1960s. Self-talk is one of the defining ideas in CBT. Many of my clients can sometimes see the first 2 foundational pieces, beliefs and thoughts, or self-talk, though most of them tend to struggle with the third piece most, emotions or feelings. It seems many of us have difficulty discovering where feelings truly come from, let alone how to control them. CBT in some aspects theorizes they come from this self-talk. That, as we mentioned earlier, it isn't what is taking place around us that creates a feeling. It is our brain's interpretation and making sense of what's taking place that creates the feelings, which in turn lead us to act. Let's put that into an example and consider. If I grew up in a multicultural environment where everyone was accepted unconditionally, I may come to believe that multicultural environments are healthy. As a result, my thought could be, I love multicultural life. This then makes me feel happiest when I'm in a multicultural environment, and perhaps not as happy when I'm not. So what happens? I then will likely act in ways that put me in that multicultural environment, which then reinforce my happy feelings, my thoughts, and my beliefs. See how that works? Unfortunately, for many people, the beliefs, thoughts, feelings, and actions, at least when they enter therapy, aren't healthy or happy, and they don't realize how they're reinforcing negative or unhappy beliefs, thoughts, feelings, and actions. Sometimes it's hard to see why things seem to go in circles or keep repeating in patterns that make us uncomfortable. By describing this system to clients, will usually have a good start for some discovery, revelations, and possibilities for change. I will say that most of my clients have sought therapy because their feelings, thoughts, or both are bothering them and interfering in their lives. Once they've gone back in time, talked about their history and how they may have formed some of their beliefs and thoughts, they start to make connections, such as why they feel a certain way, or act or don't act in response to those thoughts and feelings, and ultimately what kind of feedback they get from their actions. There are a lot more complicated layers to this. I will be detailing those more visually in my next video, where I share what I call the CBT iceberg. Stay tuned for that and deeper discussion of this theory and practice next week. So given everything I've talked about, what are your thoughts about CBT? How does it make sense, and what parts are still confusing? Remember that CBT is a model used by myself and others to help you discover more about your inner world, what your beliefs, thoughts, feelings, and actions are related to your mental health concerns and overall health. The goal is to help you become your own therapist, as well as treat yourself better. It is a time-tested and proven method used since the 1960s with plenty of studies and real-world application that's brought clients relief from anxiety, depression, substance use, and couples conflicts. I think CBT is a wonderful tool, and I look forward to sharing more with you on how I go about it. It seems to make a lot of sense to most of my clients. Though I don't use a one-size-fits-all approach, they generally like the tools that CBT offers because they're simple, easy to use, and help them gain clarity fairly quickly. If you're interested, feel free to give it a try. Stay with me for next week's episode, where I will go into more detail with one of my frequently used therapy tools, the CBT iceberg. I look forward to seeing you again.